Roach, Chapter 5, Patient and Family Teaching, Lecture C, but I want you to turn back to box 5-2 so I can clarify. You have a SATA on domains of learning: cognitive, affective, psychomotor. Those are the 3 domains of learning. You have a SATA in under cognitive domain. In this domain, the patient uses previous experiences, prior knowledge, and perceptions to give meaning to new information or to modify previous thinking. And you also have a SATA with affective domain, includes the attitudes, feelings, beliefs, and opinions of the patient or caregiver. Okay, I just wanted to clarify that. So beginning on page 58, Lecture C, again, I just want to mention something I see before evaluation, FYI. Understand the principle of motivation and realize that if someone has physical discomfort, they're not going to be able to concentrate and learn. A patient in pain is motivated to be pain-free. That's right. Not educated about a medicine. So it's common sense. Evaluation, you need to highlight this. To determine the effectiveness of patient or caregiver teaching, evaluate the patient's confidence or caregiver in understanding the knowledge of the material presented. For example, if the patient's being taught to administer insulin, a return demonstration by the patient with the nurse observing the patient's technique is an evaluation method. This is also known, as I have stated, as the teach-back method. When the patient, using their own words, they're going to use their own words, teaches the information or procedure back to the nurse. If we're teaching and we want them to do a teach-back, what kind of questions should we ask, open-ended or closed-ended, to get them to talk? Patient teaching for improved outcomes, preparing the patient and family for drug administration at home. The first check mark, for patients taking more than one drug, develop a clear, easy-to-read plan, a drug schedule for the patient or caregiver to consult. Try using a daily calendar as an inexpensive but effective means of scheduling. Suggest the use of commercially available drug organizers, those little pill boxes with the Sunday, Monday, Tuesday, Wednesday. If your patient finds it helpful to keep all drugs together, suggest using a small box, like a fishing tackle box, to hold all the containers and keep it away from children and pets. So preparing the patient and family for drug administration in the home, I do believe those check marks are SATA. So let me look through to tell you one way or the other. Continuing to look, sorry, but you don't mind. Yes. No. Okay. Okay, it looks like they're not, but I thought they were. I apologize, but again, I know you don't mind for me checking again. All right, I do not see a SATA there, but know that information. Affective behavior. I'm back on page 54. Affective behavior. Affective domain includes the attitudes, feelings, beliefs, and opinions of the patient or caregiver. It just looks like I'm missing something, but I don't see what it would be. Now I'm looking on 51. The relationship between a nurse and patient is built upon trust and respect. Relationship makes the client the focal point and is referred to as patient-centered care. Okay, so I'm just looking, so you know we need to develop a therapeutic relationship with the client. We're going to approach them, of course, with respect. Yes, we always use respect, and to get that therapeutic nurse-client relationship, we need trust and respect. So I'm going to throw that in. So key points, I'm just looking on 58, 59, or 58. Let me just read through the summary of this chapter. Patient teaching is an essential task in nursing. It involves both an established relationship and the use of teaching and learning principles. It involves supplying the patient with information and evaluating if they understand that information. Patient-nurse relationships are built upon mutual trust and respect. Nurses who understand the changing healthcare system and practice good communication, health communication skills, can empower patients, and therefore we would get better outcomes. We'd see better outcomes with patients. Good health communication includes assessment and interventions to enhance health literacy, having cultural competency, and providing resources for those with LEP. For learning to occur, one needs to be motivated. Adults learn best when they have an inner motivation. Most adults are visual learners. Others learn hands-on, while only a few learn best by listening. You will use cognitive, affective, and psychomotor learning strategies to enhance learning with patients and families. All three domains of learning help to evaluate our effectiveness when we teach. As you assess health literacy, know that the basic language literacy and understanding about health and disease are not the same. The basic language literacy and understanding about health and disease, that's different. Analysis of data may indicate how motivated a patient is to learn. Learning style preferences help plan the best methods we can use while we're teaching clients. Cultural competency and knowing if a patient has LEP guide the choice of interventions used when we're performing patient teaching. Adapt basic drug information for the home setting to ensure safety of both the patient and other family members. And this is interesting. The pharmacology in practice, page 59, think critically. Adults learn best by applying familiar concepts to new situations and having that information presented to them a number of times, repetitive. To support your learning, this book uses a case study. We will get to case studies later. I just wanted to state that, FYI. We will get to case studies. This is good. Meet the patients. Lillian Chase, 36 years old, asthma, has had asthma most of her life. And you can just look through these. Alfredo Garcia speaks little English. Mrs. Moore is 85 years old and seems forgetful and confused at times. Mr. Park, 77, staying in long-term care facility now. Betty Peterson lives in an apartment. Mr. Phillips, 72-year-old widower, and he lives alone. He's got diabetes and early stage chronic kidney disease. No children, live close. Yana Wong, 16-year-old high school gymnast, recovering from mononucleosis before the school year. So I just wanted to mention all this to show you the so many various types of clients you will care for. It doesn't matter their age, their color, their education level, their clothing style, their sexual preference, and I could go on and on. None of that matters to a nurse. The only thing that would matter is that we know how to better care for someone that's of a different culture and ethnicity. Religion. We are there to take care of people. Period. Period. So, treat people with respect. Treat your classmates with respect. And do your homework and study. This concludes Chapter 5.